Mimosa. My name is Nicole and I'm a student physical therapist. Today I'll be evaluating you. Basically what the eval entails is it'll take about 50 minutes to an hour of your time. During that time, I'm just going to get to know you and see what physical therapy can do to help you. Is that alright?
Yeah, I mean, I gotta be here, so.
Okay. So just to let you know, I will be writing some stuff down as we go. This just helps me to make sure that I'm getting all the information that you're saying today. So don't take that as me ignoring you, alright?
Yeah, that's fine.
Okay. To start off, I just want to kind of confirm a couple of things. That you are Francis Mimosa.
Mm-hmm.
You are 29 years old.
Yep.
You circled here that you're a female.
Yep.
And then today's date is September 23rd. So what do you do for a living?
I am a telemarketer.
Okay.
I get to listen to everybody's problems while trying to sell them insurance.
Okay. What kind of insurance do you sell them?
Just car insurance. Wouldn't think I'd get that many problems, but nope.
Okay. And what is your campus like? Do you have to do a lot of walking?
Once I get inside the building, not too much. Elevators are right by the door.
Okay.
Take that up to the right floor, second
Okay.
floor. Just from the parking lot to the building.
Okay. And about how far of a walk would you say that is?
Normally it would take me about 5 minutes, but lately it's like twice as long.
Okay. And what do you do in your free time?
Well, I like to do Krav Maga.
Okay.
That is something I really, really like to do.
Okay.
But after work and everything, nobody wants to get worked up that much.
Okay.
So, glass of wine, watch a movie, best relaxing.
Okay. How often do you go to Krav Maga?
If I could go to it, I'd be doing the 2 to 3 times a week. That's what I normally do. Haven't been able to go this week.
Okay. And Krav Maga, just so I understand it correctly, it's like a type of mixed martial arts, self-defense.
Yeah. Lots of punching, kicking, elbows,
Okay.
knees. It's definitely towards self-defense.
Okay. And what is your living situation like? Do you live in an apartment? Do you live in a house?
I live in a 2nd floor apartment, which means I gotta do all the stairs because there's no elevator.
Okay. So how have you been getting up the stairs?
Quickly.
Okay.
Well, not really quickly. Like quickly over one leg and then next step up, quickly over that leg again, next step up.
Okay. So what brings you into physical therapy today?
I hurt my leg.
How did you do that?
I was trying to kick my nephew.
What were y'all doing?
We got into a competition which turned a little angry and got into a more big fight.
So were y'all like trying to see who has the best skills for Krav Maga type of thing, or?
Yeah, originally it was just supposed to be a competition, but then he
Okay.
hit me, and so I tried to kick him, and then I felt the
Okay.
muscle tear,
Okay.
and yeah.
Okay. But everything's good
Ended up in
between
the ER.
But everything's good between you and your nephew, correct?
I think so. Yeah,
Okay.
I think so.
Just that you had to go to the ER. That's
Yeah, they ended up taking me to the ER.
okay.
Told me I had, or didn't have, a fracture.
Okay.
Although I told them I wanted an MRI, but no.
Okay. So they told you didn't have a fracture. Did you have an X-ray?
Yeah.
Okay.
Yeah. X-ray.
Okay. So how would you describe your leg pain? Like where would you say it is?
It's the back of my leg.
Okay. Would you say? Okay.
It's like
do you mind showing
right
me?
back here.
Okay. So more in the center.
Mm-hmm.
Okay. And how would you describe that?
It's kind of this dull ache, but the ache kind of increases as I move, and then occasionally I'll get this cramp going through it.
Okay. Do you experiencing any numbness or tingling with that?
No numbness, no tingling.
Okay. Do you have pain anywhere else in that leg, like in your thigh or in your calf?
No,
Okay.
I think so. Yeah.
What about the other leg?
No, other leg's fine.
Okay. Anywhere else, like in your arms or hands?
Not from the kick. I mean, just an old thing.
Okay. Do you mind telling me about the old thing?
I hit a wall a couple years ago. They had to
Okay.
go in and fix it, and then they sent me to OT, which did nothing.
Okay.
So, yeah.
Okay. So
Still in pain.
you said they went in and fixed it. Did you have surgery or?
Yeah, they had to go back into my hand, realign the bones.
Okay.
So,
And then about how long after that did you start physical therapy or occupational therapy?
they had me wait about a month. I couldn't move my hand for about a month, and then they had me going to occupational therapy. And the OT did not know what he was doing.
Okay.
He only had me doing these weird exercises about squeezing and extending my hand.
Okay.
And it did nothing except make my pain worse.
Okay. About how long did you go to OT?
About 2 weeks. I tried it. It did nothing except make my
Right.
hand worse.
So those exercises did have a use. Since your hand was in a position stuck in a position for about a month, those bending and straightening exercises were to make sure that your joints are moving properly and that you can develop the strength in your hand that you've lost
Mm-hmm.
to open doors, to open jars, things like that. So they all did have a purpose. I'll make sure that in physical therapy, what we do is we explain to you why you're doing the exercise. And if it does cause pain, let you know that, hey, you might experience some pain with this, but with the goal of your pain should be decreasing as we were going through the session. Is that all right?
Mm-hmm. Yeah, that
Okay.
would help. At least
Right.
then I know why I'm doing something.
Right, and it makes a lot more sense because I can tell you this is doing nothing, but it did have a purpose. So
Yeah.
we will for sure make sure that we do that. So what activities do you realize that cause your pain to feel worse?
Standing up, walking around, stairs, definitely stairs. And I can't do any sort of kicks or Krav Maga.
Okay. About how soon do you realize after you start to do these activities that your pain comes on?
Standing up, it's kind of like as soon as I put weight on it, it has pain goes through it. And then walking around, it starts increasing slowly and slowly. That throb in it just gets
Okay.
worse. And then I can't do any sort of kicking because it just immediately starts hurting.
Okay. Then activities that make your leg feel better?
The ER doctor said I could rest it and ice it, and then he gave me some meds for it, some pain meds.
Okay. And about how long after you take either the meds or rest it, do you notice that the pain starts to go away?
Probably in about 15 to 30 minutes, it starts feeling a little bit better. Doesn't go away all the time, but it gets better.
Okay. So, if you were to describe your pain in the morning, how would you describe it?
It's probably not that bad. It's just a little stiff and sore, but it goes away almost as soon as it starts moving a bit.
Okay. Then throughout the day?
It starts getting worse and worse as I work it out.
Okay.
Stairs, I have to go immediately down the stairs to get to work, right?
Right.
So that just aggravates it more and more, and then walking aggravates it more until I get to work, and then I can finally sit down again.
Okay. So it's worse with activity?
Yeah.
Okay. And then at night, how would you describe it?
Not bad. It doesn't keep me from sleeping. It's occasionally it'll wake me up because it'll
Okay.
get like this knot in the back of it,
Okay.
but I have to just wait for that to go away a bit, and then I can go back to sleep.
About how long does it take for you to go back to sleep?
About 5 to 10 minutes.
Okay. So what I want to do right now is I just kind of want to go over this form that you filled out in the waiting room.
Okay.
So you would like for physical therapy to make your pain feel better.
Mm-hmm.
And you mentioned that you're taking benzos, Lithobid, and Mobic. Do you
Yeah.
mind telling me what those are for?
Well, the benzo is for my anxiety. I get anxiety sometimes in unfamiliar situations.
Okay.
And the Lithobid is for bipolar
Okay.
disorder. Don't like taking it. It doesn't make you feel good.
Right. It changes how you feel. And,
Yeah.
So how often would you say that you're taking those medications?
Well, I have to take the Lithobid. I have to take it, but I don't like taking it, so I really only take it whenever I go to work.
Okay.
But The benzos, not too often, only when I start feeling that anxiety, I'll take it. And then the Mobic, this last week I've been taking it every day.
Okay.
Just because the pain hurts so bad.
And that's was prescribed to you by the ER doctor?
Mm-hmm.
Okay. And so here you've checked that you learn best by doing. We ask that question because whenever we're in the clinic and we're teaching you a new exercise, that we teach you the way that you learn best. So just to make sure that I understand correctly, that if you're able to do it and then us kind of give feedback to make sure that you're doing it correctly works best for you?
Yeah, I guess. Just being able to see it, someone do it next to me, and then I can adjust myself for it.
But as you're doing it, like,
Yeah.
so doing it simultaneously as the demonstration?
Yeah, yeah.
Okay. Got it. Just wanted to make sure. You're not pregnant. You're
Nope.
not feeling down or depressed.
Don't think so. No.
Okay. So here you mentioned that you were bothered by little interest or pleasure in doing things.
Well, I can't do what I want to do.
Okay.
I'm stuck in my apartment. I'm not going to go up and down the stairs multiple times a day
Right.
with my leg hurting. So I can't do Krav Maga, no kicking. I can't go out and do anything with my friends. My leg hurts.
Okay. So it's the fact that you can't go and do what you've been doing.
Yeah.
Okay. You circled here that you feel safe at home and in the workplace. That's good. That you don't smoke or chew tobacco.
Mm-hmm. That's right.
Here you mentioned that you drink alcohol 5 nights per week. Is that just the 1 glass of wine at night?
Yeah, it's just that glass of wine in the evening to wind down.
Okay. Here you say that your pain hasn't changed since the injury. Is that correct?
Yeah, it hasn't gotten any better.
Okay. Here you say that you have no history of high blood pressure, diabetes,
No.
and that your family doesn't either.
Mm-mm.
And here you circled that you experience headaches. Do you mind telling me a little bit more about that?
Yeah, when I get a little worked up and angry and all that, I start getting this throbbing headache. So,
Okay.
yeah.
And your prior surgeries, that was the hand, correct?
Yeah, that's me hitting a wall.
And here is where you marked that you had pain. I just want to make sure that your mark is the same as my mark.
Yeah, that looks right.
Okay, I just want to make sure that I understand where your pain is. And here you filled out what we call the patient-specific functional scale. Basically, it's 3 activities that you're having difficulties with, and it kind of gives us an idea of like what we can work on that will get you back to doing the things that you love, such as Krav Maga, being able to go up and down the stairs.
Mm-hmm.
So do you mind telling me a little bit more about what issues you're having with the stairs?
Yeah, I start going up the stairs and it just hurts to put that weight on my leg.
Okay.
So I'm kind of pulling myself over that leg as I go up the stairs. Makes it really hard to go upstairs.
Okay. And then with kicking, what about kicking causes the pain? Is that just the straightening of your leg?
Well, yeah, that's most of it. Straightening on my leg, I can't put any weight on it on the other leg to do a kick with the other one.
Okay.
So any sort of kicking I can't do.
Okay. And then the kicking is what limits Krav Maga as well?
Yeah.
Okay.
Yeah. That, and if there's any other one leg things that I'm doing, I can't put any weight on the leg.
Alright, so now what we're going to do is we're going to go back in the clinic and we're going to do a couple of activities and see what we can go on from there. Is that alright?
Yeah, let's go do it.
Alright.